require.
Thank you, Mr. Chairman. Mr. Secretary, welcome back to the committee, and I'm looking forward to welcoming you to Oregon next week. I hope you'll enjoy that visit. I appreciate your reference to the budget that has been proposed by the President, and I look forward to working with you in the committee to be able to parse out those elements, because I think there are a number of things that really have broad bipartisan support, they make sense, and they meet the needs of the American public. Last year, we made historic investments in the American Rescue Plan to lift people out of, away from a crisis at a horrific time. And as we continue to build back from the pandemic, it's clear that our health care system requires continued support to meet the needs of the American public. But I think it's important that it's not just enough to spend money. And we've talked a little bit about this in the past in terms of what steps we can take to be able to focus and get more value out of what we expend. We need to make investments to create long-term changes that better meet the needs of the current moment, improve people's access to care, and produces better outcomes. It's no secret that our health care is expensive. Without the policies like increasing the ACA premiums, the average monthly premium last year would have been 53% higher. I agree that that was an important step, but subsidization alone is not the answer, and it does not negate the fact that healthcare spending accounts for nearly 20% of the GDP. I appreciate the ranking member referring to the waiver process taking place in Texas. And we've talked a little bit about this in the past. I hope that there are ways to enable other states to implement innovative solutions to lower costs using Section 115 or 1332. My own state of Oregon, which you will be visiting, enacted a waiver process to implement per capita growth spending limits, meeting quality standards and the metrics, and it ended up saving more than $1 billion for the federal government in excess of the waiver amount, and it continues to provide those savings. Secretary, I wonder if there's a way that we can work together to explore what the administration could do using the waiver process. I know it's a priority also of my Oregon colleague, Senator Wyden, the chair of the Senate Finance Committee. Is there an area that we can move forward to further enhance the utilization of those waivers?
Congressman, first, great to see you, and absolutely, I believe there are ways to use those waiver authorities. I would urge you to take a look at what your neighbor state to your south, my home state of California, is doing when it comes to those 1115 waivers in trying to expand its access to care through the Medicaid program. I would also point out to you that in the President's budget, where he makes an unprecedented investment in behavioral health, mental health, substance use disorder, we are calling for more focus at a community level. So it's not just the major institutions that offer someone who needs mental health care the support, but you can actually get it far closer to home, and hopefully in some cases be in a community setting where you can stay home. And so we're going to try to expand access if we can work with you to get the resources to make that possible.
Well, I look forward to exploring what you're doing in California. I know there's interest in Nevada, the state of Washington, and Utah. And I think it's an opportunity for us to be able to contain costs and improve care. And I look forward to being able to explore that with you.
Thank you.